citizens and residents of St. Kitts and Nevis, our Federation of St. Kitts and Nevis today joins other United Nations member states in observing the International Day for Disaster Risk Reduction, which this year is being held under the theme #OnlyTogether and sub-theme #DRRDay. Of course, this year's observance of International Day for Disaster Risk Reduction maintains the overarching aim of the UN in promoting a global culture of disaster risk reduction through collective action that is designed to save our planet. Such a combination of effort is manifested in advocacy and adoption of best practices that positively impact the lives of persons living in disaster-prone areas of the world by A, reducing the number of such persons who are affected by natural and man-made hazards, and B, lessening the economic losses due to the disasters. It should be noted that this 2021 observance of IDDRR is happening at a time when the G20 nations must urgently extend a meaningful hand of cooperation, friendship, and funding to developing countries who must establish sustainable climate change adaptation priorities that will reduce risk and build resilience, especially as it is these same first world countries that account for some 80% of greenhouse gas emissions that directly contribute to global warming, rising sea levels, droughts, and floods. It is also worthy of note that the International Day for Disaster Risk Reduction is taking place just a few weeks before COP26, the UN's climate change conference that is charged with delivering increasing levels of commitment to effect a marked reduction in greenhouse gas emissions and support climate change adaptation across the globe. Since its inception in 1989, observances of the International Day for Disaster Risk Reduction have been organized in an effort to achieve two core objectives. One, to create a global culture of risk awareness and disaster reduction, and two, to celebrate the ways in which global communities and individuals are A, reducing their exposure to disasters, and B, raising awareness of the importance of controlling risks that are being faced by these same communities and individuals. The international observance of IDDRR is also intended to assess the progress being made to reduce disaster risk, loss of lives, livelihoods, and health. This assessment is being done in keeping with the Sendai Framework for Disaster Risk Reduction, which was adopted by the UN at the Third World Conference on Disaster Risk Reduction that was held in Sendai, Japan in 2015. Essentially, the Sendai Framework is intended to guide disaster risk reduction programming until 2030 and calls for a people-centric and action-oriented approach to disaster risk management, regardless of the relative sizes of the disasters, whether they are natural hazards or have been caused by man-made, environmental, biological, or technological actions. Our National Emergency Management Agency wishes to reassure the general public that the annual work program of the agency is guided in large measure by the Sendai Framework, which is comprised of some 7 targets, lettered A through G, and 4 priorities for action in order to reduce existing disaster risks and prevent new ones. These 7 targets, which are to be assessed based on the reduction in disaster-related losses, are intended to be met during the years 2016 to 2022. However, for this year, 2021, Target F calls for UN member countries to, quote, substantially enhance international cooperation to developing countries through adequate and sustainable support to complement their national actions for implementation of the present framework by 2030, unquote. As was the case with the other 5 targets tackled between 2016 and 2020, Target F is intended to be met by adherence to the following 4 priorities. 1, understanding disaster risk. 2, investing in disaster reduction for resilience. 3, strengthening disaster risk governance in order to manage the said risk And 4, enhancing disaster preparedness for effective response and to build back better in recovery, rehabilitation, and reconstruction. The UN has set some 8 indicators by which success in attaining Sendai Framework Target F can be measured. Some of these indicators are total official international support for national disaster risk reduction, actions provided bilaterally and from multilateral agencies. An example of this indicator is the donation of the 2 new field hospitals by the government and people of the United States of America, which were handed over earlier today. This donation is a major contribution to health risk reduction as a result of the ongoing COVID-19 pandemic and its potential negative impact upon the country's institutional healthcare infrastructure. Another indicator is the total official international support for 1, transfer and exchange of disaster risk reduction related technology, and 2, disaster risk reduction capacity building in developing countries. And the third indicator is the total number of developing countries supported by international, regional, and bilateral initiatives to strengthen their disaster risk reduction related statistical capacity. It should be noted that these targets and priorities of the Sendai Framework are expected to be met within the next 9 years, the same time by which the UN Sustainable Development Goals, or SDGs, should come to fruition. NEMA has decided to observe the International Day for Disaster Risk Reduction 2021 via a week of activities designed to sensitize the public to the work of the agency, its role in disaster mitigation, and the imperative for community and citizens' engagement insofar as disaster risk reduction is concerned. This week-long public awareness campaign would have started on Friday, October 8th, with the launch of a scavenger hunt dubbed Finding Nemo. This was followed on Monday, October 11th, by an innovative virtual service of guidance and renewal that was streamed live on YouTube from NEMA's headquarters at Limekiln Bastille in order to keep in line with COVID-19 protocols. Other activities planned for the week include the following. Today, Wednesday, the official address by myself as the co-chair of the Disaster Mitigation Council on the occasion of International Day for Disaster Risk Reduction. On Thursday, there is the launch of a NEMA staff video, and on Friday the 15th, October, the NEMA staff retreat will take place. All of these activities are meant to strengthen the capacity of NEMA staff, reinforce partnerships and collaboration with national stakeholders, such as NEMA's district groups, other critical state agencies such as the Ministry of National Security's Fire and Rescue Department, emergency support agencies such as the Ministry of Health, and non-governmental agency partners such as the Red Cross. The management and staff of NEMA wish to use this special occasion to say a sincere thank you to every one of its partners and stakeholders, along with our citizens and residents who may remain steadfast in their partnership with the agency as it executes its mandate for disaster risk reduction that is meant to save lives and reduce losses due to man-made disasters and natural hazards. The Federal Cabinet commends the management and staff of NEMA for their tireless efforts to keep the people of St. Kitts and Nevis well-informed and safe insofar as disaster mitigation and risk reduction are concerned. The Cabinet does not take this commendation for granted, particularly when one considers the inordinately high demands that have been placed on the tiny staff complement at NEMA. Exceptionally heavy demands have been placed on the small human resource base of NEMA as a result of the sustained and unprecedented impact of the COVID-19 pandemic, for which the agency has had to play a pivotal leadership role over the past 19 months. On behalf of the Federal Cabinet and the co-chair of the Disaster Mitigation Council, the Attorney General, Honorable Vincent Byron, I take pleasure in congratulating NEMA's National Disaster Coordinator, Mr. Abdia Samuel, and the rest of NEMA's staff for their yeoman service to our country during these difficult and challenging times. I extend best wishes to the agency for the continued successful staging of the week of activities designed to observe the 2021 International Day for Disaster Risk Reduction, which is being observed under the theme #OnlyTogether. Thank you for your attention.
Thank you very much, Honorable Wendy Phipps, for such a comprehensive speech. I would like to recognize in the audience with us the Honorable Attorney General Vincent Byron Jr., who has joined us, and he's also the chair of the Disaster Mitigation Council. Today we have a special guest with us, Lieutenant Colonel Shane Moran, Chief of Security Cooperation from the Military Liaison Office at the Bridgetown U.S. Embassy in Barbados. He will now make a presentation.
Thank you, Mr. Samuel, and good afternoon to everyone here present today in the room, as well as everyone dialing in throughout St. Kitts and Nevis. It is an honor and a pleasure to have this unique opportunity to speak with you tonight regarding the recent donation of field hospitals to St. Kitts and Nevis. As mentioned, I'm U.S. Air Force Lieutenant Colonel Shane Moran. I work at the U.S. Embassy in Bridgetown, Barbados, and had the distinct opportunity to work with not just the St. Kitts and Nevis Defense Force, but also NEMA, Ministry of Health, and other agencies for the past 2 years. I'm here this week in St. Kitts and Nevis as part of the U.S. government donation of 2 field hospitals to the citizens of St. Kitts and Nevis. This donation, valued at about 1.3 million U.S., has been made possible through the close collaboration between the U.S. Southern Command, led by Admiral Greg Fowler, the U.S. Embassy, as well as the St. Kitts and Nevis Ministry of Health, NEMA, and the Nevis Disaster Management Department. These field hospitals donated today were built to order specific for St. Kitts and Nevis, and in the United States, and they are similar to ones that have been employed throughout the global pandemic across the United States at hospitals, clinics, and the disaster agencies. Each of the field hospitals for St. Kitts and Nevis come with the same configuration and equipment. Each hospital is equipped with 6 tent modules that provide approximately 3,500 square feet of medical space. They are constructed with highly durable material that is resistant to harsh climates and strong winds. The frames are comprised of aircraft grade aluminum and provide a sturdy structure for the field hospitals. The modulos are dynamically configurable and can be arranged to suit the unique nature of the area in which they're deployed. Each Each tent is equipped with its own HVAC unit and customized rugged containers that are powered by a portable diesel generator capable of powering not just the HVACs, but also the lights and any medical equipment that needs to be installed inside. For operations. This configuration allows to austere environments across the islands as needed. Inside the hospitals, you'll find each equipped with 40 beds, plus internal sanitation systems, water filtration systems, and showers. Overall, the field hospitals are rugged, durable, and deployable, and able to respond to medical and natural needed whenever and wherever. This week, we also have had the opportunity to conduct a 4-day in-person intensive training program with approximately 30 professionals from across the government, to include St. Kitts and Nevis Ministry of
And your team. At this time, I want to invite Superintendent
Tests. For persons who are quarantined at a private residence, you are only permitted to travel via a COVID-19 certified taxi to any of the 3 hospitals in St. Kitts between the hours of 7 and 8 a.m. to be sampled. Incoming travelers who are not fully vaccinated are required to remain in quarantine for at least 14 days, either at an approved private residence or at a COVID-19 approved hotel. If you choose to quarantine at a private residence, you will be required to pay for the services of private security assigned by the Commissioner of Police. Again, you would only be released from quarantine upon receiving a negative RT-PCR test. I wish to take this opportunity now to remind you that the nightly curfew is still in effect from 1 a.m. to 5 a.m. During this time, every person is required to remain at his or her place of residence, except if you are an essential worker who are required for work, or if you have to travel for essential medical emergencies. If you have other reasons to be out during the curfew hours, you are required to have written permission from the Commissioner of Police. And you can make application on the police website at police.kn. All businesses and enterprises are required to be closed by midnight to allow for sufficient time for all personnel to adhere to the curfew hours. As usual, I will close by reminding you to adhere to all the COVID-19 protocols. That is, wear face masks when in public, practice good hand hygiene and other sanitization behavior, avoid crowds and crowded spaces, maintain your physical and social distance, and most of all, get vaccinated. Thank you.
Thank you, Superintendent Henry, for your report. I will now call on Dr. Cameron Wilkinson, Acting Chief Medical Officer, to provide us with the HEOC update.
Thank you very much, Mr. Samuels. As you would have heard before, I am acting for the Chief Medical Officer, Dr. Hazel Laws, who is away on a much-needed vacation. I also know that she is listening and looking right now, so I just want to tell you to continue to enjoy yourself, and I'm looking forward to seeing you back on the 20th of this month. I've been keeping a record. I also want to say a big thank you to the persons who work behind the scenes to put this situation report together. I speak of Dr. Marissa Carty, Dr. Rafael Rosales, and Akila Moore. With the CMO being off and me having to be working with them, I understand now the magnitude of the work that they have to do to get this presentation ready for you. As of the 12th of October, the Federation had a total of 2,466 cases to date. In Nevis, 395, and in St. Kitts, 2,071. We have a total of 976 active cases. I'm happy to see that the active cases have fallen below the 1,000 mark for a few consecutive days now. Of these, 110 are in Nevis and 866 are in St. Kitts. We also have a total of 1,469 persons who have recovered, 282 in Nevis and 1,187 in St. Kitts. We currently have 10 persons who are hospitalized in the Federation of St. Kitts and Nevis, 2 in Nevis and 8 in St. Kitts. They are all stable and no one is on the ventilator. We have recorded 21 deaths. When I gave this presentation last week, this number was much lower than this, and I said that the deaths will continue to rise as long as people don't come forward and get the best protection against severe disease, hospitalization, and death, which is the vaccine. And I want again to appeal to persons to come forward so that next week when I come, that number would not be rising as it has been over the last several weeks. This next graph shows you the 2 waves that we have been through. The second part of the graph is showing you the second wave. You see that we had several peaks. I'm happy to announce that we appear to have troughed and we are beginning to see a downward trend in the number of positive cases. This next slide shows the percentage of cases by age group. And you can see the most common age group affected, those persons between the ages of 20 to 40. However, there is no age group that is immune, and we see that from the 0 to 9 years old, we have about 13.5% of persons down there being affected. And when we speak about getting vaccinated to protect yourself and to protect others, these persons in that low age group, they cannot be vaccinated, and they're dependent on you to go forward and get vaccinated so you can decrease your chance of getting infected, of transmitting the virus to these persons. And so we all have a moral duty to protect those who can't protect themselves. We also see that in the 10 to 19-year-old age group, we have about 15.9% of the cases occurring there, and we now have a vaccine, the Pfizer vaccine, that can be offered to persons between the ages of 12 and 17. It's offered to everyone over the age of 12, but for the first time over the last several weeks, we have a vaccine for our teenagers. And I want to encourage the parents again to take their teenagers out to be vaccinated. If we look at how things have progressed over the last week since I presented here a week ago, we registered a total of 172 new cases over that period. As it relates to the hospital admissions, we had 2 admissions and 2 discharges, and so the hospitalization basically stayed the same. The good news is that over this period we had 312 recoveries, and so that is significant, and I want to wish everyone who is fighting the disease now a speedy recovery. Unfortunately, over the past week we had 5 deaths, and the deaths continue to be mainly among the persons who are unvaccinated. So when we examine the 21 deaths that the Federation has have recorded thus far, we had 18 in Nevis, 18 in St. Kitts and 3 in Nevis. And of these 21, only 3 were fully vaccinated. And the majority of these persons were not fully vaccinated and had comorbidities, meaning that they were suffering from diabetes, hypertension, kidney disease, heart disease, etc. And again, there is this misunderstanding about getting vaccinated and having a pre-existing condition. Some persons say because they have asthma, because they have heart disease, because they have kidney disease, they're not strong enough to take the vaccine. These are the persons who need to go out and get vaccinated, because if you have to fight that chronic illness with COVID-19, you may not survive. And even getting vaccinated, if you have if you have significant comorbidities, just getting mild COVID disease can push you over. And so the most important thing is for you to come forward and get vaccinated. Because when we look at the persons who are becoming infected, next slide, we see that the majority of the cases, they are occurring among the persons who are not vaccinated. Now, it's important to note here that we said that if you are vaccinated, you have significant protection against getting COVID-19, but you are not exempted, and so persons who are vaccinated can still get infected. However, they tend to be infectious for a much shorter period of time. The majority of them may be asymptomatic or have mild disease, because the vaccine protects you against severe disease, hospitalization, and death. And so as we move forward and we have a greater proportion of the population vaccinated, and the virus continues to spread, we will still see vaccinated persons getting COVID-19, but with most of us being vaccinated, we can release the stranglehold that COVID-19 has on us, and this can become just a mild form of the disease that you will have and don't even know. And so we want to encourage persons to come forward and get vaccinated. Our vaccination program continues, and we continue to see success with the vaccination program. As of yesterday, we had 69.6% of the adults in the population who were fully vaccinated, and I'm just dying to see, or anxious to see, us get to the 70% mark. We also have 76.9% of the adults who have received 1 shot. What is good about this vaccination program is almost every single one who came for their first shot, they're coming back for their second shot. And so wherever on the thermometer we have seen the first shot, the second shot crosses there. And so I know in the future we would see 76.9% of the population fully vaccinated. I know in the future we will get to the 80% mark that we were aiming for in December. And at the rate at which we are going, we are on trajectory to get to 80% by December. The second thermometer shows the vaccination rate among our children, and I'm happy to see that this is moving along also. To date, we have 5.6% of the children between the ages of 12 to 17 who are fully vaccinated, and 10.1% with 1 shot. I want to make an appeal again to the parents of these teenagers. The only how we can keep our schools open is if you go forward and get vaccinated. Now, a couple of weeks ago, when the Prime Minister had his conference here, he said that he wanted us to get to 80% by December so that we can see a further relaxing of some of the restrictions. And getting to 80% might sound like it's a daunting task, but I want to simplify it. So we have a total of 26,430 adults who are over the age of 18. Sorry, 80% of the population over the age of 18. That number comes to 26,430. And so that is the number we need to get to reach to 80%. Where we are now, we currently have 25,405 adults who have had one shot. And so we need a further 1,025 persons vaccinated to get to the 80%. And what this means is if the persons who are vaccinated form themselves into groups of 25, each group of 25 only needs to bring one person in who is not vaccinated to be vaccinated, and we can be there tomorrow. And so you can see it is within our reach. And so I want to ask you, if you have done the right thing by getting vaccinated, you form yourself into groups of 25, go out and bring just one person, and we will get those 1,025 covered, and we'll be at 80% vaccinated. So it is within our grasp. You heard about the new SROs, and some persons appear to have been confused by what it said. Next slide. I'm not going to read through the jargon that is placed in the SRO, only to tell you that this is simply telling you that, number one, you need to have a negative RT-PCR test to enter the Federation, which everyone knew before, within 72 hours of getting here. And once you are here, you should be tested within 24 hours of arriving, and once you get a negative test, you can be released from quarantine. So what this means then is if you get to your hotel and you're tested, and you can have a result back in 4 or 5 hours, you will be out of quarantine. So that's basically what the rule is stating. I want to tell the citizens and residents that the government continues to work to keep you safe. We know the best protection is by the vaccine, and we continue to seek to acquire more vaccines. And so we should be having a shipment soon of some more Pfizer vaccines, and we are also working on getting extra doses of AstraZeneca. But for now, we have more than sufficient supply, but we are making sure that we will never be short of vaccines. And so I want everyone to continue to come out to use this precious commodity. We have started the education program in the schools. We started first last week by having a virtual meeting with the top brass in the education sector and every single headmaster, mistress in the primary and secondary schools to explain the vaccine and the vaccine program. And we have now started sessions with the parents. We're having PTA meetings to speak to parents about the vaccines. We have done with the Charles E. Middle School, the Bastia High School, and a few other schools in the rural areas. We'll continue this throughout this week. And the schools will be given appointments to go to the clinics so that they can have the vaccines done. We're hoping to have at least 80% of our high school children vaccinated so that we can continue to have in-class learning, because it's very difficult for children to get ahead with the virtual learning. I've said before that I am happy that I was not a school child within this period of time, because I could not imagine having to be sitting behind a computer trying to understand physics, maths, and chemistry without having a teacher right in front of me. And so we need to make sure that our children get back into in-class learning, and the only how that can happen is if they are protected, and the best protection is through vaccination. You heard about the field hospital. I'm not going to say much more about this other than to say that the bed capacity of the Joseph M. France Hospital, which is our main hospital, is 164. And we took 20 of those beds and dedicated them to COVID patients. And so our capacity was decreased. And I was happy to hear that the field hospital in the first instance will be deployed at the Joseph M. France Hospital, adding an extra 40 beds to our capacity. And that will help us in our fight against COVID-19 and also the other conditions that we continue to fight there. A number of persons will be happy to know that the task force, we were actively engaged in discussions with plans for Carnival. Last year, December, there was a virtual Carnival where there was no in-person events. And at that time, we had 0 persons who were vaccinated, and we had a virtual event. And so we believe that the minimum we can have is a virtual event, and with the significant vaccination coverage that we have, there is latitude for discussion to see how we can have other events, and I'm pretty certain that you'll be hearing more about this, and so keep your hopes up. Last week, I spoke about the antigen tests and the fact that the World Health Organization still recommends that the gold standard is the RT-PCR test, but as the science has developed, the antigen tests are becoming more sensitive and specific, and they're finding a greater use in the management of the COVID-19 patient. This is not to be confused with the rapid antibody test that right here at this podium, Minister Phipps at the time, who was the Minister of Health, said that we would not use, and there is no country I know that's using the rapid antibody test in terms of diagnosing persons with COVID-19 disease, because if you were to have a rapid antibody test, you would not be able to tell the difference between somebody who is vaccinated or somebody who is infected, because the antibodies will test positive. We are talking about a different test, which is the rapid antigen test. And as I said, it is finding a greater role in the management of persons with COVID. Next slide. The sample is taken from the nose or the mouth, and the results are obtained very quickly within about 15 to 30 minutes. And antigen tests that have a sensitivity greater than 80% and a specificity greater than 97% compared to the RT-PCR tests, they are finding greater use in the management because, number one, you get the results very quickly, and two, you don't require any significant laboratory infrastructure to have this set up. The World Health Organization gives guidance on how these can be used, how, when, and where. Next slide. And the 4 scenarios under which these can be used is for case finding, contact tracing, investigating outbreaks, and monitoring. Who is controlling it? Yes, and monitoring. Okay, and we believe that we may soon be able to use the antigen tests in some of these conditions, because if, for example, there was an outbreak in the prison or there was an outbreak in a nursing home, instead of in the past where you'd have had to do an RT-PCR test on 100 inmates, you can do the rapid antigen test on the 100 inmates and get your results back in a very short space of time and determine what measures you will take. Or if there was an suspected outbreak in a school, you can test a class right away, get the information, determine whether or not you need to take out 1 or 2 kids, and the classes can continue. And so the recommendation that the Ministry of Health is considering, and I'm pretty certain that this will be put before the Cabinet for them to make the final decision, is in the use for case finding, outbreak investigation, and monitoring trends. We will continue to use the RT-PCR test for the contact tracing for the time being, and we will still use the RT-PCR test, which is the gold standard, to confirm any positives that we have. We will only be recommending antigen tests that are approved by the World Health Organization and the FDA. And we know that there are some countries, when people are leaving, they accept the rapid antigen tests for the outgoing passenger. And so there's absolutely no reason why, going forward, we would need to insist on somebody having an RT-PCR test that would take about 3 to 4 hours for them to get the results back to leave, when the country that they're going to will only accept, an antigen test. And so these are things that are under consideration. If this is passed, however, these tests will only be performed, that is, a sampling by a trained professional, and they will only be recognized when they are run at our local certified labs. Next slide. I was speaking to a gentleman just yesterday, and he told me, why don't you, when you are here, give the people one reason why they should go forward and get vaccinated. And so I decided I would listen to him, and instead of giving 1, I give 10. Okay, and so number 1, the vaccine is free. When I say there's a cost associated with the vaccine, and the government has invested quite a lot of money to get the vaccines here to you, but there is no barrier to you getting the vaccination. You can walk into any clinic 7 days a week during the scheduled clinic hours and get vaccinated, and so it's important for you to take advantage of this. The vaccines also, we know they have a high efficacy. The AstraZeneca, it's about 84.3, the Pfizer about 95, and so it's important for you to make sure that you take this protective cloak and cover yourself with it. When I spoke about the 5 deaths that we had over the last week, if Carmen Henry came here and said that these 5 deaths were 5 persons who were speeding on a motorbike without a helmet, the entire population would say, why don't they stop speeding? Why don't they wear a helmet? Well, if we had 5 deaths, mainly in persons who were unvaccinated, we should be asking, why don't they take the vaccine that has been proven to be effective? Okay, and so we know that the vaccine gives you a best chance at survival, and so a 4th reason is that it saves lives. And it is safe, okay, because these have gone through significant rigorous testing from animal trials to phase 1 to 3 trials, and billions of doses have been administered globally already without any significant side effects, and so we need to make sure that we step forward and take it. You not only protect yourself, but you protect those around you, especially the vulnerable. And so there are a lot of persons who have children at home who cannot be vaccinated. You have elderly persons who, if they get infected, they can succumb to COVID-19. And so you're doing this not just for yourself, but for those persons around you. You also need to do it to protect the healthcare system. We saw around the globe when countries were going through their waves, how their healthcare system was being overwhelmed. We saw just a week or 2 ago when our testing system got overwhelmed and people were complaining that they were in quarantine for an extended period of time because we had a bottleneck with the testing. You can imagine if that bottleneck was at the hospital where persons were getting sick and we didn't have enough beds. And so by you protecting yourself from severe disease, by you protecting yourself from being hospitalized, you help to protect our healthcare system. We keep hearing people speaking about, the entertainment sector not making any money, the cruise ships are not coming. And so there are a number of things that are affected adversely by the stranglehold that COVID-19 has on us. And if more of us come out and get vaccinated, we can release the stranglehold and get back the economic activity that we had prior to COVID-19. Another important reason is to protect future generations. There are persons before us who decided that they were going to roll up their sleeves without all the information that you have here now, and got vaccinated against polio and smallpox and measles and mumps, so that these diseases were eradicated, and we did not have to worry about this. And so in protecting yourself now, we can make sure that we can eradicate COVID-19 so generations to come will not have to be dealing with this or the variants that can develop if it continues to spread. Another reason why you should get vaccinated is to help stop the spread of fake news, because when you go forward and people see you get vaccinated, you're basically sending a strong message that I believe in science, I believe in the evidence that tells me that the vaccine is safe and effective, and I believe that this vaccine will save my life. And for all of us who complain about how things are now, it is the quickest way for us to get back to normal. So those who want carnival, those who want to go back to church, go back to in-class learning in school, whatever you had before COVID-19, by us getting vaccinated, that's the quickest way for us to get back there. There is good news on the horizon as it relates to the treatment of COVID-19. There's a drug, molnupiravir, that is being developed by Merck, and they have applied for emergency use authorization from the FDA. It's the first antiviral pill against COVID-19, and it represents a major milestone in the fight against COVID-19 because it is very convenient. It's just a capsule that you will swallow. It is inexpensive compared to the antibody cocktail that President Trump had when he was sick, and it will be readily available because you can actually take it at home. It's just 4 capsules that are taken twice a day for 5 days, and it has been proven to half the hospitalization and deaths. In the clinical trials, it was used in unvaccinated adults who had comorbidities, diabetes, hypertension, etc., when they took it within 5 days when they were infectious. As a matter of fact, the clinical trials were stopped because it was being so effective, and that's why they're applying for emergency use authorization. So if this is approved, this will be a major step in the fight against COVID-19 and putting COVID-19 behind us. Unfortunately, it would not be given to pregnant women because of the mutations and birth defects that might occur because of this. I want to, in my penultimate slide, encourage persons again to go out and get vaccinated, to wear a mask, to maintain your hand hygiene, to social distance. And if you're ill, you need to stay home. And in my last slide, while we are fighting COVID-19, there are a number of persons who are fighting other diseases. This month is Breast Cancer Awareness Month. This Friday coming is Mammogram Day. And I want to tell those persons who are fighting COVID-19 and fighting the brave fight against breast cancer to let them know that our thoughts and prayers are with us, and that's one of the reasons why I'm wearing my pink tie today in support of those persons who are fighting breast cancer. Stay strong. I thank you.
Thank you very much, Dr. Wilkinson, for your presentation. I wondered myself why you were wearing the pink tie, because I know normally you have on your blue. So, yes, I too want to give my support to the Cancer Awareness Month. My father would have died from prostate cancer. I could tell you it was a horrific experience. So, to all those of you who are fighting breast cancer and any other cancer, we ask you to be strong. I also had my sister, which would have been my father's first child. She would have died from colon cancer as well. So I understand the pain and the sorrow that cancer brings to family and friends. Now I will bring my presentation to you. I want to highlight my presentation with Finding Nemo. If my presentation can be uploaded. Right. So our wonderful planning team and NEMA, in celebration of the International Day for Disaster Risk Reduction, they would have come up with a week of activities. And Ms. Petty and Ms. Southwell and a happy group of my staff came up with this wonderful challenge. How do we educate people by using some methods to draw them out, as they said, from the current challenges that we are facing? And as you can see on the screen, a number of criteria were developed. So again, Ms. Ulrika Lennon-Petty from the planning unit led this team. The exercise required participants to complete and submit tasks. So there were a number of tasks that were given, and you were to complete these tasks and submit them. Finding Nemo was added to this year commemoration and commemoration. I'm not going to basically read everything because you can see it on the screen. And the goal for this year for the IDDR activities was to combat depression and somber moods being experienced by residents because of the current pandemic environment. So the planning committee sought to encourage individuals to take a break from those challenges, that global challenge. So they came out with this particular activity so that we could get out of this mental state of lockdown. So the hunt, which was when it was first posted, it took approximately 15 minutes for the first applicant to register, and from then, there was a constant stream of registration within the first 24 hours. Ms. Beres Williams, the district coordinator, stepped up to the plate, according to the team, and actually elevated the difficulty of the tasks. And these tasks, the initial tasks, according to the team, were designed by Ms. Petty. She thought that the tasks were too easy and we might have persons complete all the tasks before we can actually finish the entire period for the game. As the task began to flood in, there was a fear that the hunt would be completed in one day. So again, the team became innovative and they created the task, some additional tasks to make the exercise a little longer. So how did we measure the participation and effectiveness of the exercise? The exercise director, Mr. Spetty, based upon the responses of many participants, stated that it was tiring but very educational. Some persons stated that I had fun. Some persons stated that I learned something new about Nemo. Persons who took part in the Finding Nemo, we want to say we value your participation and encourage you to continue to adhere to the COVID-19 protocols and to connect with our agency via our various contacts and other social media platforms so that we can actually continue to have that conversation with you as we attempt to build resiliency and continue our comprehensive disaster management strategy. Without further ado, I want to introduce to St. Kitts and Nevis, the region and the world, the winners of Finding Nemo. Who are they? Our first place winner is Miss Sherima Matthew. Sherima Matthew, first place winner of Finding Nemo. She won a tarpaulin, a 20 by 20 tarpaulin, a first aid kit, a small cooler, and we say you cannot drink as yet, and a 50 pack of face masks. Our second place winner, and who we want to congratulate, is Janine Lake. Janine Lake. She also won a 20 by 20 tarpaulin, a flashlight, and a box of 50 face masks. And our third place winner is Danisha Grant. She won a flashlight and again a box of face masks. Ladies and gentlemen, you have your winners being displayed on your screens. Thank you to all the participants who took place in this exercise, and to the winners, we congratulate you. I don't want to make much for the mention, but just to say that we have a vital asset in our fight against the COVID-19 as we continue to delicately manage the COVID-19 situation in St. Kitts and Nevis. No, the field hospital is that we have the expectation that we are going to have multiple cases, that we're going to be overrun with cases. It's a mitigative asset. It's a proactive approach supported by our international cooperation and partnership for us to be ready to respond to the need if it ever arises. Ladies and gentlemen, crisis is not only created by natural events. There are man-made events and other events that can create many challenges that can lead to crisis. At present, around the globe, there is a global supply chain bottleneck. And as the National Disaster Coordinator for the National Emergency Management Agency, I want to advise you to ensure that you manage your resources and supplies that you have at present until the global community finds a solution to this challenge of the supply chain bottleneck. We have seen in the United Kingdom where the government has had to use the state resources such as the military to help with the transportation of supplies for the day-to-day consumption of their citizens. And we also see that in the United States, Los Angeles Port, one of the busiest ports, have adopted a 24-hour, around-the-clock work schedule to help with the bottleneck. And my understanding is as well, in St. Kitts and Nevis, we have not been impacted or affected, but the potential to be impacted and affected in the delay of supplies as a state or country that relies on 90% of importation for supplies for daily consumption. Please exercise caution and please understand in no way, shape, or form this is to create any panic or hysteria. This is about us taking the necessary preventative measures or mitigative measures to be resilient against these global challenges. Over the past few briefings, I have been informing you of the food distribution program. I just want to inform you that it has been completed to date, and food has been distributed to Her Majesty's Prison, the New Horizons, Sadler's Home, Defense Force, Cardin Home, Children's Home, JNF Hospital, School Meal, Early Childhood Development, as well as Addis Place, who you have not seen on the screen. We have also had supplies utilized to create care packages, food care packages for persons who are in quarantine and also isolation. Commendations are in order for the Social Services Department, who continue to provide this support. We have been hearing about the 24-hour quarantine procedure that has just been passed in the new statutory rules and orders. Now, I am not going to go over this again, but I need to bring some clarity to individuals who keep calling and asking about the whole matter, and persons who have some doubts. The law is rather clear, and it says that once you receive a negative RT-PCR test, then you will be released. It's just basic and simple as that. I am not going to go into any deeper with it. There are a number of arguments that persons are bringing, but the law is clear that you will be released once you receive a negative RT-PCR test. That does not mean that if you come in the country with a test that you took 24 hours before, that is not a valid test for you to be released from quarantine within 24 hours. That's your travel entry test. Also, critically important for you to note that if you want to integrate into society, it's an RT-PCR test. The antigen and the rapid test we said last week is something that it's being proposed to the cabinet for consideration for persons who want to travel overseas once the country accepts or the destination accepts rapid or antigen tests. So I wanted to bring some clarity to that. Some other clarity I wanted to bring, sorry to go back there, is that the field hospital is not stationary to Warner Park. So it's not like we have all sorts of persons and we are taking them to Warner Park and the hospital is there. The reason why the field hospital was erected, assembled at the Warner Park was because the inspectors, the team, the group of technical persons that would have visited a number of sites, they actually recommended the Warner Park because of the wide open area or the wideness of the Warner Park. This is critically for you to understand. Because of the configuration and the various concepts in which the field hospital can be erected, or they call them shelters, can be erected, we needed that ample space so the participants or the technical persons who are going to be, who were trained to assemble and disassemble the 40-bed field hospital would understand the various concepts in which it can be utilized and erected. That's why Warner Park was chosen as the area for training. Again, we have heard from the Ministry of Health this morning in the handing over ceremony that the area identified for the erection and operationalization of the field hospital will be the JNF premises. So I hope that brings some clarity to persons who have been concerned that we have a number of persons or a busload of persons all over, and we're going to take COVID-19 people and take them to Warner Park, and they're going to be there. That's not the case. That was never the case. And I hope we have clarity on that. Now, we have also been receiving a number of reports, and Superintendent Henry emphasized on it. Persons who enter the Federation and they go to their homes to quarantine, or private home quarantine, whether it be a villa, whether it be an apartment, a single dwelling home, whatever it may be, you are required to go to the JNF hospital from 7 a.m. to 8 a.m. to be tested, and you must travel in a COVID-19 certified taxi. And if you look at your screen, the taxi must display the travel approved seal. And that is how the travel approved seal looks like. It almost looks like a belt running through a suitcase. Please abide by this policy. We are seeing persons, based on the reports that we are getting, having persons pick them up at home. They are driving in front of the vehicles, and they are going to the JNF hospital to be tested. And these same individuals are picking up the person upon completing their testing and taking them home. That's a violation, because the regulation is rather clear that no one should visit a quarantine site. So please ensure that you follow the protocols. We are doing our best to get back to a sense of normalcy, so you need to help us. Next slide, please. We are experiencing some weather conditions within the region. Mr. Elmer Burke and I would have had a discussion, and he would have stated that there is a tropical wave that is passing through the region that will bring about some showers off and on. So everyone, please exercise cautions when traversing through the road and communities, in particular the areas where our waterways interact with our road network. Also, it's important, walk with your umbrella if necessary, and protect yourselves and your households. Yes, so that's the weather for the weather forecast for St. Kitts and Nevis. Tonight, partly cloudy with a 70% chance or high chance of showers. Tomorrow, partly cloudy with a 60% or moderate chance of showers. Sunrise tomorrow, 6:03 a.m. Sunset tomorrow, 5:51 p.m. I want to thank you for listening, and we will move directly into the question and answer section. And I have a number of questions that Mr. Leslie Williams have been sending to me, as well as other individuals. Okay. First question, Von Radio. Can you confirm the last COVID-related death, number 21, is on St. Kitts or Nevis? That's one. 2, Von Radio received a number of reports of individuals having to remain in quarantine for more than the maximum stay, 14 days, awaiting their test results. Could you kindly explain under what circumstances would a person have to stay in quarantine for such an extended period of time, provided that they do not have COVID-19? And the third question is, could you provide an update on the number of COVID-19 patients that are currently hospitalized on St. Kitts? Dr. Wilkinson. And you know you're the opening batsman.
I don't know whether Von Radio sent in those questions before I gave my presentation, but I will ask all the media houses to listen to the situation report before you forward in your questions. I said in my presentation that there were a total of 10 hospitalizations between the Federation of St. Kitts and Nevis, 2 in Nevis, 8 in St. Kitts. As it relates to the COVID deaths, case number 20 was in St. Kitts, 21 was in Nevis. Also, when one hears complaints about persons being in quarantine for an extended period of time, you really need to look into the information behind what you are being given, because someone can be in quarantine for 14 days, 21 days, 28 days. I can tell you scenarios under which it occurs. We've had before an adult who tested positive, and they are in a home where they have 4 or 5 other children who at the time were not positive. And so that adult could be taken out of that home and placed into a government quarantine facility with the hope of being out in 14 days when the test negative. On the 10th of their stay there, one of the children tests positive, and that mother would have to quarantine with that 5, 6, or 8-year-old child because that child cannot quarantine by themselves. And so when that child is placed into quarantine with the mother, she would have to now assume the risk associated with the child. And so when the child starts counting the 14 days from the time they entered, the mother would have to be there for the period of time that the child is there. If another child of hers took sick 20 days in, and she has to stay in the quarantine with that child, her quarantine period would be extended. And so sometimes you will hear or even see videos of people putting out appeals saying how long they were in quarantine. But we can't come and give you the information about these persons and tell you the reason why they are there. There was a time when we had a bottleneck, and there were some persons who had to wait a few days before they got their results, but there's no one who is going to be locked up an extra 14 days waiting for results, and we don't have it. I think I answered all four. Yes.
Our next question, I guess this is intended for Superintendent Henry. There's a rumor that a group of guests broke quarantine in a particular hotel and left the hotel to patronize several beach bars for a couple of hours before returning to their rooms. This is frightening. Can you confirm whether this quarantine breach took place, what was done to bring the offenders to justice, and whether these high-risk guests would have exposed the unexpected patrons at these bars? Concerned divisions also want to know the status of this particular status of the private security at the mentioned hotel. Not the first time that a breach at this facility or high-end property has taken place. Thanks.
It would appear as though that person is referring to a breach on Nevis. I will tell you, like I mentioned last week, of the breach at a hotel here in St. Kitts, where the persons have been arrested, have been charged, and is awaiting trial. There was a breach in Nevis. Persons concerned, they too were arrested, and they were charged and taken before the court. I understand the matter would have been tried a couple of days ago. I'm not certain of the outcome, but prosecution always follow breaches that come to our attention following an investigation. So any breach, once they come to our attention, they are investigated, and persons concerned are prosecuted. That is why we ask persons who are patronizing bars and restaurants to always follow the protocols. Just in case there is someone there who might be infectious, you will not be at risk, or you would reduce your risk. Once you're following the protocols, maintaining the physical distance at the bar, wearing your mask when you're not drinking, and practice good hand sanitization.
Okay, next question. We are seeing some incidents where persons are being found dead in their homes, where persons just drop dead on occasions. We hear so much about blood clots being associated with the vaccine. What are some of the signs that would indicate that one has blood clots? Also, can the health department implement a program wherein a person fully vaccinated can have checks done to ensure blood clots are present in his or her body? After all, dying as a result of blood clot after being fully vaccinated defeats the purpose of fighting COVID. Dr. Wilkinson.
I just want to mention here first that blood clots were around before COVID and before the COVID vaccines. There are a number of conditions that can predispose persons to develop blood clots. For example, persons who take the oral contraceptive pill they're at risk for developing blood clots. Persons who have a sedentary lifestyle, if you sit for a long time with your feet in one position, you can develop a blood clot. If you are bedridden, you can develop a blood clot. And there are a number of drugs that can predispose persons to develop blood clots. So, and as we continue our vaccination program, there are going to be people who will continue to get diseases that they got before COVID-19 or before the vaccination. And so we cannot erroneously associate these diseases with the vaccines. There are a number of reasons why persons can die suddenly, and this has been happening again before the start of the pandemic, and it will continue to happen. You ask about signs of blood clot. If someone, for example, is having a blood clot that went to the lung, they might have some tiredness, some shortness of breath, some increased sweating, and so these are signs that they will have to look for. And so basically, if you are not feeling well, whatever symptom you may have, I would suggest that you seek medical care. Blood clots in the leg, the person might realize that they're having pain in the calf when they walk, when they dorsiflex or move their foot up and down, especially if they just came from a long flight. And so those would be signs or symptoms that they can have that might suggest that they have blood clots. There are some persons who have certain cancers, prostate cancer, pancreatic cancer, where you can also have an increased risk of developing blood clots. And so we keep saying that the vaccines are safe and effective, and we don't have any evidence of anyone dying from the vaccine here in the Federation of St. Kitts and Nevis.
All right. Another question that came in via Mr. Williams again. What is the system for informing persons of test results? There are 2 cell numbers that are customarily given out, but no one answers these numbers. Why can't there be a one-stop shop for communicating results to persons who have been tested? Dr. Wilkinson.
What I can tell you is that on Friday morning from 11 to 12, I'll be on a program at WinFM with Mr. Markman, who is the point person with the contact tracers, and we'll be going through all of this information in great detail. We'll also be answering your questions, because I know there have been complaints from persons about calling 311 and not always getting someone, and so we'll be addressing all of these matters with the key persons on Friday morning. So I want all of you all to tune in, and if you have any questions, we'll address all of them there.
Thank you, Dr. Wilkinson. And this brings us to the end to the question and answer segment of the New York briefing. As established by Mr. Williams, I would like to take this opportunity to thank the Honorable Attorney General, Disaster Mitigation Council Chair, the Honorable Wendy Phipps, the Co-Chair of the Disaster Mitigation Council, the Acting Medical Chief, the Medical Chief of Staff, Acting Chief Medical Officer, Dr. Cameron Wilkinson, as usual with his patience to answer all the health-related questions, our Superintendent of Police, Superintendent Henry, who, trust me, always going and never complains. I also want to thank our special guest who joined us today, Lieutenant Colonel Shane Moran, and also Caitlin Moran, who is here with him. I also want to thank ZIZ, our teams and ZIZ, John James, and others, as well as Ms. Vesta Southwell, who keeps on ticking, and Dr. Marisa Carty, who is the Public Relations Officer for the Health Emergency Operations Committee, and also Ms. Christmas Jacob, who is providing the sign language, and I hope she gives me some lessons before we start these briefings. And I want to thank Ms. Ophelia Blanchard and our intern who continues to be with us with such interest, Anthony Jatlil, who is here as an IT technician in support of our operations here. Thank you to those persons who send in their questions, to our viewers, and dedicated fans, and also to the media houses who continue to support the fight against the COVID-19 with helping us to provide information and also asking questions. Thank you once again, and we will see you next week, same time, same place. Have a good evening.